Today I will teach you how to take blood pressure using a manual cuff as well as an automatic cuff. Before we learn how to take blood pressure, we must first understand what blood pressure is. Blood pressure refers to the systemic arterial pressure measured at a person's upper arm and is a measure of the pressure in the brachial artery, the major artery in the upper arm. Blood pressure is the pressure exerted by circulating blood upon the walls of the blood vessels. A person's blood pressure is usually expressed in terms of systolic pressure over diastolic pressure and is measured in millimeters of mercury, or mmHg. Systolic pressure is peak pressure in the arteries, which occurs near the end of the cardiac cycle when the ventricles are contracting. Diastolic pressure is minimum pressure in the arteries, which occurs near the beginning of the cardiac cycle when the ventricles are filled with blood. Gravity may affect the blood pressure via hydrostatic forces, so it is important when you are taking a patient's vitals that they are sitting down and are resting. If you are taking your own vitals, please sit down. Next is the oscillatory method. It's Latin for the word listening. We'll be using a stethoscope to hear the artery walls contract and relax. Place the patient's arm so that their palm is facing upwards and feel for the brachial artery. Next, grab your stethoscope and place both knobs into your ears. Take the blood pressure cuff with the two knobs on the side, the sphygmometer and the pump, and be ready to wrap the arm. Place the cuff 1 inch above the patient's forearm crease and make sure that the indicator is by the brachial artery. Place the sphygmometer onto the cuff and with your pump in your dominant hand, move the knob so that it's closed tight so that you'll be able to pump it. Place your stethoscope onto the brachial artery and listen. Pump up until 160. Then slowly release. When you first hear something, that will be the systolic reading, and the next will be the diastolic. For at-home monitoring, place 2 fingers on your brachial artery. Once you feel your pulse, place your arm through the cuff and line the indicator where your brachial artery is. That red line is the indicator on this cuff. And once you get it situated, make sure that it's 1 inch above the crease of your forearm. Then press the start button and the cuff will inflate. Watch the monitor until it stops to see your blood pressure. Lastly, there are 3 types of blood pressure. Normal blood pressure is 120/80. Hypotension, which means low blood pressure, is 90/60 or less. Hypertension, which means high blood pressure, is 140/90 or more.